have to remember. Hey guys, it's Jamie and Christine
Hello.
with Iowa Diabetes. Happy Valentine's Day.
I know, do you like our decorations? We try to make it look festive for you guys, and we wore pink and red.
We are ready, and we really wanted to take the theme of Valentine's Day in relationships and really talk about, like, what does that mean for diabetes?
Right.
If you have it, if you've got a loved one for it, and like, how are we talking with each other and relating with each other? So we did ask for you guys to post on Facebook about how you may handle somebody who is the diabetes police. So Christine, what is the diabetes police?
I know, and that's a good question because we hear that like diabetes police, and I think it just means that when you have someone in your life who is constantly on you about your diabetes. What do your blood sugars look like? You can't eat that. That's not good for your health. And and it could be with the best intentions, but it comes across as maybe sometimes being a little bit judgmental,
controlling or nagging, or some of the things that they come across, even though, like you said, the best intentions are met by it, because somebody just wants to keep you safe, keep you happy, healthy. So we want to talk a little bit about that and want to hear what are some of the best ways you've handled that diabetes police. And then we can talk about some of the things that we've heard our patients do as well.
Exactly.
So post your comments, post your questions. If you've got different questions about, how you deal, how would be the best way that some of our audience have dealt with different situations, chime in.
Definitely.
We have some of the best experts, and it's not us,
it's you guys. Right, and there's so many different situations and relationships and how you can handle it. Every person's a little different in how they want to be treated, in regards to diabetes. So please share your comments because, there's someone out there who could really benefit from that if you have something to share.
Absolutely. So we can talk through some of the relationships that we've seen that we've helped manage. One of the most common ones that we've seen is that parent to child, where the child has diabetes. And you're doing a lot of that right now. So what have you seen as you've worked through it?
One of the things that I've seen is obviously the parents really being concerned because blood sugars being high. But there's a part of that, and a lot of times I'm actually educating the parents. For example, I had some situations where there was a misunderstanding of the importance of taking a basal insulin. Yeah. And that if we don't take that basal, blood sugars are going to be high. And so the first step is really education on both parts, because there's a lot of things that the parent might not know. And so they're not understanding of why the blood sugars are high, why this is happening. And so getting that education to really be able to understand better is key. Another thing is, sometimes you have as a parent, I'll give you an example of when I tried to homeschool my child in kindergarten during COVID. We have a great relationship, but when it changed roles into like that teacher role, there was a lot of sensitivities like, well, you don't think I'm doing that right. And you don't think I'm good enough with this. And then the relationship changed. And that can be hard for a parent-child dynamic. So sometimes having a third party come in and really help the child to understand the importance of blood sugars and, checking their glucometer
and why we might want you to take insulin and all of that, right?
Right. Sometimes coming from an outsider, it's going to be much more receptive than if it continuously comes from the parent. And that can be true in lots of different areas.
I've got 3 kids at home, and trust me, when a teacher says something, a light bulb goes off in my kid's head, even though I've been preaching it to them for the last year.
Right? There's just something about that person, that change, that can really make a big difference in that relationship. Because obviously as a parent, you're like, I just want you to be safe. I want your blood sugars. But then what happens is the child is continuously hearing that, and they go, well, I'm not going to do it because I'm sick of being told, and then they rebel. And so having the child understand too, hey, when you have that attitude, who it hurts is you, because your blood sugars are high. You're not feeling good. You're tired. You're increasing your risk of secondary complications. Yeah. So trying to help both sides understand the importance.
Yeah. And I think navigating that is very, very difficult.
It can be.
And it's going to change as that child grows.
Exactly.
I think it can be easier in kind of the younger years. There's going to be more control with the parents. They feel like they can do more.
Right.
But I think in those preteen to teenage years, where that child now has to take ownership of their disease state, that really starts the struggle.
Right.
And I mean, I'm entering preteen with my kids, and there's already a struggle, and they don't have diabetes.
Right. So yeah, sometimes being that in between and looking at both sides and really helping to come up with a good solution for everybody can be really helpful in that situation.
Yeah. Now, we've also seen where the parent has diabetes
Mm-hmm.
and can be on the older side and is needing help from that child.
Right.
That can be really tricky as
Mhm.
well, depending on where that patient or where that person is in their health.
Right.
They're used to taking care of themselves.
Yeah.
They're losing that ability and that
Mhm.
independence.
Right.
And sometimes that is extremely scary. And it's navigating that scary situation with these people.
Mhm.
And it's hard.
Right.
And sometimes I think the kids get scared also,
Right.
especially with some of our newer technology. Right now, we can share our sugar information with providers, but we can also share it with caregivers as well.
Right.
I think there's a comfort there, and there's a comfort knowing that somebody else can see the sugars, but it can also be very, very frightening for a child who's then woken up in the middle of the night
Right.
when they don't live with you, and then
Mhm.
how to get a hold of you.
Right. And how to navigate that as well can
Yeah.
definitely be challenging. And that's one of the things too with having conversations on both sides, you know, from the child to the parent. You know, I love you, I care about you, I want you to be safe. What would be helpful for me to do, you know, to guide you along this? I don't want to, you know, because the roles shift a little bit.
Yeah,
And then also having the parent understand the importance of
the safety
Right.
aspect of getting that child involved to help you
Mhm.
when you need it. But I think it's that conversation to understand what level of care and what level of help do I
Mhm.
actually need from you.
Right.
This is the kind of support that would help me and increase my comfort versus just going in and kind of trying to take over.
Yep, exactly. I think that's the hard part is when it just there's that takeover perspective or you just do without the conversation is
Yeah.
when their defensiveness
Yes.
kicks in.
Yeah.
Frustration kicks in
Right,
on all ends.
They're like, I took care of you for 18 years, 18 plus years.
Because I said so. That's why you should.
Yes. And so I think I love that conversation. And I think a lot of our theme today is about that communication and having that open communication
Right.
with those that you're trusting to be involved in your care.
Right.
And that brings us into those new relationships,
Mhm.
right?
Yeah.
So you're starting a new relationship, and this could be with a friend. This could be with somebody that could possibly get romantic with you. And it just could be also a new peer, like an employee relationship.
Uh-huh.
I've got stories of like my parents talking to me about when they learned some of their coworkers had diabetes and how they would react in meetings
Right.
when these people would go low
Mhm.
and only certain people would know what's going on.
Yeah.
And it's confusing if you don't know what's
Right.
going on. So I think you've got to find those people that can be your support so that you can create that circle of love,
Right.
we'll call that no matter what situation you're in, you've got somebody that knows what's going on and can help you. So finding those trusting relationships. So how do we figure out how to like talk to the people about it, right?
Yeah, and I think one is your comfort level. Everyone has a little different comfort level on sharing what's going on with their health and their diabetes. I know some people are like, I'm totally upfront with it. I tell people, hey, I have type 1 diabetes. Here's what it is. But and then there's some people who don't necessarily have that comfort level.
Very, very private. Don't want to use it as not necessarily as a crutch, even if you're open about it, you're not using it as a crutch, but sometimes other people feel that can be perceived that way.
Right.
And it's hard. It's hard to figure out. I mean, even without diabetes, who are the people that I trust?
Right.
Who do I want to talk to and work with?
But obviously, especially those you work with, those you're with, having them. The first thing is, hey, just so you know, especially if you're on insulin. I mean, that's a big part because if your blood sugars are going low, and they don't, and let's say you pass out or you're acting confused and they don't know you have diabetes, that's a health concern, you know, that's a safety concern. And so even just sharing, hey, just so you know, I have diabetes. Here's how I manage it. I'm not asking for your help, you know, if you're
or
not.
anything.
I'm just letting you know. So in case you happen to see if I'm acting a little confused or if this is going on, you'll know.
Yeah, and then
Here's
make
the
sure
response.
I've got candy here, or I've got glucose tabs here. Please help me get them. And I think that's what you've got to create in any of your environments.
Right.
One of the ones that struck me was I work with diabetes camp, and it's teenage years, and a lot of the counselors have diabetes, and they're counseling teenagers like, what's it like to go to college?
Yeah.
What's it like to develop all these new relationships?
Right.
Because many times these teens are living in a town where everybody knows they have diabetes. Everybody knows, you know, what to do, but now they're going off into a different environment without their parents.
Yeah.
And they've got to do that. And all the theme is the same. Find one or two people that you can go out with that know that you have diabetes, that can help keep you safe if you are going to go have alcohol.
Yeah.
Because alcohol, yes, if you have the sugary drinks, it's going to rise your sugar. But remember, it makes our liver stop producing sugar.
Yeah.
And so it is a risk factor to go low, especially if you're moving around or doing something. So if you're going dancing, lots of activity happening with that.
Yeah.
So you need somebody that can help you know what to do if you start to display symptoms of going low.
Exactly.
And having those trusting people with you. So in all your situations.
Exactly. And then I heard, you know, one thing where it said, you know, let's say you know someone, you've had that, you're in the relationship already, they know about the diabetes, and then you have someone, your blood sugars are high, you know, constantly, and you're like, okay, how do you respond to that?
Yes.
And one really good example that I heard was saying, hey, you know, I appreciate you caring about me and my diabetes and you're concerned about the blood sugars. Maybe instead of asking me or like nagging me about my blood sugars being high, how about we go on a nice long walk this weekend and come up with some food that we would enjoy making together that is not going to spike my blood sugars. But doing something in that approach that let's do something healthy together that's going to benefit, honestly, both partners.
Right.
And it's going to help the diabetes without, because most people don't want to make changes based on like, why aren't you doing that? Why aren't you doing that? Why aren't you doing that?
Right.
It's not very motivating, right?
It's not. Or you can't have that. You can't have ice cream. You can't have cookies. You can't have cake. And that's one of the things that I think we've talked about before. Like, you can have small portions of sugar, of carbs. We all need carbs in order for us to live our lives. It's the portion size and how we balance it out with everything else throughout our day. And so making sure that you're communicating in a positive manner and not just yelling back at them, because sometimes that's the initial response of
frustrated.
Hey, I'm frustrated. I'm just gonna lash out, and I'm just gonna say yes, I can, and then I cut a bigger piece of cake than I should have. Versus that, let's go on a walk. Let's get some exercise.
Right.
Let's lower our sugars, and then let's find something that we can do together to help lower that sugar. So I loved that example because one, you're then developing that togetherness in that relationship.
Yeah, I mean, I know a lot of times my patients get frustrated because like, well, no one in my household is diabetic and they'll eat whatever they want.
Yes.
And then I'm supposed to just like eat healthy.
Yeah.
And that can be a challenge too, right?
Yeah.
And so that goes back to that communication. Okay, we might be having pizza tonight, but what could we make like
on the
side, like a spinach salad or something, so that way I can eat more of that. You know, you can still have a piece of pizza as a diabetic. It's okay.
Yeah.
But like we said, with balancing it. So a lot of it, part of that from the non-diabetic standpoint is the education. There's some education because and we talked about, you know, sometimes Google isn't always your best resource for education. So I know I have a lot of my patients who will bring their significant others into our visits.
Absolutely.
So that way we can discuss these things together, or they'll attend some of those diabetes education classes, you know, where you're really getting a good reference source, and then you guys can learn about these things together.
One of the things that we'll ask during clinic visits, diabetes education visits, is who does the cooking? And who's doing the shopping, who's doing the cooking. We ask that actually before we even see you in a pre-survey, just so that we can understand what's going on and what's kind of the dynamic in your house. And then who are you cooking for? Are you cooking for young kids? Are you cooking for just you? Are you cooking for multiple people? And then our dietitian will absolutely invite them in. She'll make sure that whoever's cooking gets to come to these talks so that they're learning about some of the same things that we're telling you guys as well. And I think that's absolutely key. Because I mean, we all should maybe not have pizza every single day, right? Why not?
Right.
We should all have that big side salad with one piece of pizza. We're not saying cut pizza out.
Right.
I mean, I don't think I could live without pizza on some days of the week. But you make that side salad, or you buy that salad along with the good pizza, and then you've got yourself a balanced meal.
No, I agree. And then, there's also the more romantic side of things that sometimes, hey, blood sugars might go low during certain events. And how do you handle that? And what do you, so having those conversations beforehand, I think is also important, even though it might seem a little bit awkward, but having an understanding, I mean, it might affect spontaneity a little bit, which can be hard on the diabetic partner because they feel like they're taking away from the relationship. So understanding both aspects of that, and that, yes, there can be a good, well-balanced, healthy relationship, but there needs to be a conversation there.
Yeah, it's all about communication.
And I think that's the main gist of any of these relationships. One, if you're diabetic, understanding a lot of times the people in your life, they are giving us advice because they care and they love you. So one, understanding that. But two, setting your boundaries with people. I appreciate this, but actually what I need and what would help in general would be this. Have that conversation about what's the best way to approach it. And if you're the opposite, if you're the partner that doesn't have diabetes, doing the education and really, working with your partner on how do I not be naggy with this, but still supportive.
And maybe asking, like, how can I support you better? And say, I want to be able to help you in this journey. I want to be a part of your life. How can I do that best?
Exactly. And if you guys have any additional suggestions, please share them. This is a really big topic that covers lots of different types of relationships. And we by no means are covered everything today. So share below if you have some suggestions as well.
And it is such a topic that is not covered very often in the world of diabetes, but it's a huge one. So use this as a conversation starter. Get out there. Let us know your best advice and help us change diabetes.
And have a wonderful Valentine's Day.
Bye, guys.
See ya.